Alzheimer's and other forms of dementia are menacing and oppressive diseases. First and foremost, they take their toll directly on those who are afflicted, but they can and do cause much wider spread devastation. Those who have seen it up close and personal know that this can include financial, physical, relational, and, for those who are so inclined, even spiritual fallout. I have gotten into and will get further into those angles in other videos, but among the myriad negative effects are the various emotional and psychological consequences of Alzheimer's disease, and with dementia caregiving. Some of these are well known, and a few of them have received some wide discussion, at least in general or abstract terms. But there's one issue that has tormented me personally. And reading the comments on some of my videos, I get the impression that I'm not alone in this. So in this video, I want to talk about how to feel and maybe what to do when caregiving efforts drive you to agonize over questions like, am I an awful person? Does this or that thought make me a horrible person? Ten reasons how being a caretaker can make you feel like a terrible person. This will be rough going. It was rough going for me to record it. I'm going to try not to linger on any specific point and just kind of sketch everything out. As always, your comments are welcome, especially since it's almost a sure bet that I missed something. Number 1, missing the signs of dementia. If you're like me, you might have a tendency to punish yourself for not recognizing the evidence of Alzheimer's disease, or for misinterpreting the signs that you did see. As I've explained in several videos, my mom seems not to have recognized my dad's dementia at all. When I came into the picture, I immediately knew something was wrong, but I didn't understand what I was witnessing. Frankly, I thought my dad had turned into a jerk. In retrospect, it is so easy to feel bad for having thought ill of him, and to reproach myself for not having been more perceptive or more intuitive, not catching the Alzheimer's earlier. But realize Alzheimer's is a tricky disease, and as I explained in a past video, even doctors can fail to recognize it for what it is. So don't beat yourself up. Number 2, being unable to help them. A major and continual problem is our seeming inability to provide meaningful assistance to our loved ones. When my dad was struggling to remember a name or an event, a memory, I often failed to get him to acknowledge an answer that I knew to be correct, and I felt like a failure for not being able to communicate with him better. Realize it's not like helping a non-afflicted person remember something they've temporarily forgotten. A normally functioning person can know that they have forgotten something, and after it's brought back to their attention, they can remember what they've forgotten. I mean, it sounds obvious. All bets are off when you're talking about a cognitive impairment like dementia, because Alzheimer's literally destroys the brain. At a certain point in time, the cognitively afflicted person may no longer have the memory or have any means of retrieving it. Even more, as caretakers, we're powerless to stop the progression of the disease. Given the present state of things, Alzheimer's will inevitably progress from early stage to middle stage to late stage and end with the person's death. This is obviously a deeply distressing fact. And even though Alzheimer's is only one of any number of terminal illnesses, Alzheimer's and other forms of dementia not only destroy the body, but they destroy a person's memories, a person's personality, the ability to recognize family and friends. It's gut-wrenching when your loved one doesn't recognize you, or when they repeat over and over that they just want to go home, even though they are in a safe and loving environment, one that you have bent over backwards to provide for them. You feel terrible when you make a loving home environment and it goes unrecognized, unacknowledged. And it's true that once this kind of impairment goes far enough, once it gets bad enough, they will be unable to appreciate what you're doing for them. Further, realize that just your calming voice or loving touch is helping them at some level. The most important thing is that you are objectively providing a safe and secure environment for them, not that they subjectively recognize that fact. Number 3, calling in authorities. Alzheimer's sufferers may have outbursts. Some might sob uncontrollably. Others may laugh inappropriately. And it's easy for you, as a caretaker, to become distraught when you can't calm them, when you cannot comfort them, when you can't convince them to stop. Now, my dad was on the opposite end of the emotional spectrum. He frequently exploded in anger. Just what do you do when things get that heated? I once called a dementia support group, and I will not mention the name of that, and I asked them this question. What do I do when my dad is in the middle of an angry outburst? Believe it or not, the advice I was given was call the police, which after my dad's next angry outburst, I actually did. Honestly, I have no clue whether this advice represents any kind of organizational policy or if it was just the quirky opinion of whoever it was that happened to answer the phone that day. And I'm not saying that the step of calling the police is never warranted. It may be. You have to be the judge of that. But in my case, in that case, the ensuing encounter was very discouraging because the police were essentially like, what do you want us to do? And at the end of that, I realized that that intervention was unsustainable. I couldn't do that all the time, and probably I would never do it again. And in fact, I don't think I did. Now, don't get me wrong. My dad settled down in that moment. But I was made to understand in no uncertain terms that the police had neither the training nor the manpower to function as at-home caretaking orderlies. And it's not like my dad learned some lesson that he could just file away in his memory bank so that the next time, he felt like getting angry, he might second-guess himself. That's not the way Alzheimer's works. He probably wouldn't even remember the episode. But realize you do what you can with the data you have. I like to draw an analogy with the daily weather forecast, with meteorology. You might plan your activities around the expectation of sunny skies. If you did your due diligence, you watched the weather report, you checked the radar, then if it turns out that it rains instead, it's not your fault. You did what you could. The best available information is sometimes wrong. There's another aspect of this calling in authorities angle, and that has to do with something less dramatic, namely interactions with your loved one's doctor. As I noted elsewhere, physicians often depend on family members to know that something is wrong with a loved one. Cognitively, In my case, I wrote a letter to my dad's primary care doctor, alerting him to the fact that my mom, my sister, and I were all extremely worried about my dad, especially with his driving. Specifically, I had to push the doctor to write a report that, at the end of the day, ended up getting my dad's driver's license revoked. That felt really lousy. Really lousy. I felt like I was going behind my dad's back, like I was betraying him. What I had to realize was that there are other people's lives and well-being at stake. It wasn't simply about my dad and my dad's autonomy. What if he confused the brake and the gas pedal while he was at the local park, with families walking everywhere and little kids bike riding and playing and running all around? No, I felt that, as unfortunate as it was, and it was, that it had to be done. And ultimately, I would say it wasn't me doing anything to my dad. It was the Alzheimer's disease just working itself out. Number 4, being embarrassed by them. But of course, when your loved one loses mobility, loses the ability to drive and to get around by themselves, loses some of their autonomy, it doesn't automatically mean that they become homebound shut-ins, at least not until the dementia becomes far enough advanced. Now, it probably means that you have to be the one to pick up the transportational slack, as it were, and probably not just to doctor's appointments. If you're in a position of having to assume caretaking duties all by yourself, and see my recent video for that, then you might have to cart them along when you do the shopping, when you run normal errands. And even if you've got help on those fronts, your afflicted loved one is still going to need haircuts. Maybe they gain or lose weight and have to try on a whole new wardrobe. You might even elect to include them in other kinds of entertainment or leisure time activities. My dad always enjoyed the outdoor theater during the summer. and my mom and my dad had their favorite restaurants. But this kind of thing can give rise to a number of awkward situations. For example, I was personally at a church service where my dad caused an obscenity-laden disruption. Several times he caused a scene at a local store, so much so that at least once he was asked to leave. He even picked a fight with a relative during a family reunion over some slight, whether real or perceived, that went back decades, evidently. Now, these sorts of things are just reflections of the dementia, but they can make you not want to take them out anywhere. Realize that your loved one may benefit from interpersonal interactions, but sometimes the events have to be carefully chosen. Some events are just too loud, there's too many people, too much going on. They end up getting overstimulated, and they end up getting stressed out and possibly overwhelmed, and that's when emotional outbursts can happen. So if possible, try to choose events that are going to be calming, that won't be disturbing to them, if you can predict that. But what can you do about feeling embarrassed internally? Firstly, I think you should realize that this reaction is totally understandable. Just ask parents of unruly kids at the supermarket. Something I wish I would have done more frequently than I in fact did was to try to alert people around me to my dad's predicament. Now sometimes this is a bit dicey because if you say something out loud, that might irritate your loved one just by hearing it. But there is a way of alerting people around you without making a huge fuss. Namely, there are little business card-sized announcements displaying texts like, "The person I'm with has dementia. Please be patient. Apologies for any inconvenience." In my experience, most of the time, when bystanders react negatively, it's because they think that the person who is misbehaving is doing so freely, is choosing to do that, is just being a jerk. But if you can let people around you know that your loved one is cognitively impaired, they're often much more forgiving. Number 5, losing patience with them. But speaking of these awkward situations, it's not just the loved one who might react badly. You yourself might react badly. Because it's not always easy for caretakers to remain calm and collected. And there's certainly no shortage of composure testing situations that can arise, both in the home and outside the home. In addition to that, providing care and monitoring and helping with activities of daily living can become tedious and monotonous. Depending on your demeanor, one of your constant struggles might be losing your temper. It's easy to become impatient when you have to say the same things over and over and over. Again, child rearing is similar in this regard. But with kids, at least they're small and they're acquiring the ability to think and learn and remember. Not so with a dementia-afflicted adult. Realize you might not be able to handle caretaking all by yourself. At some point, you might need to seek assistance. This might mean that you have to have a heart-to-heart with relatives and ask them to step in, whether temporarily or on an ongoing basis. But it might also mean that you have to explore professional care options. As I've discussed elsewhere, there are services whereby people can be brought into your home to help you. There are facilities that provide respite care, which is a break on a short-term basis. There's hospice care, there's adult daycare, and of course, eventually, nursing homes might be the only long-term viable alternative to home care. That doesn't mean you can't be or you shouldn't be involved in their day-to-day care, because you can visit them in the nursing home regularly. Number 6, feeling your loved one is a burden. Another way to say this one might be that you find yourself resenting their decline. I mean, it's justifiable and natural to lament their physical and mental deterioration. But what I have in mind is slightly different. What I have in mind is when you start to resent the fact that you have to give so much of your time caring for their needs. You can easily become bitter, or you might develop a grudge that you're having to put your life on hold. Or you might be deeply affected by the fact that your loved one just can't understand and appreciate what you're doing for them, what your sacrifices are, and the extent to which, you've had to rearrange your entire life to care for them. Relatedly, you might become depressed or even panicky at the emotional, the financial, or the physical strain, or all of them. Again, this may well involve you having to take leave from a job and so on. So realize that you're only human. Your capabilities and your resources are finite. It's one thing to think and feel these things, and it's another thing to allow them to affect your caregiving. It's important for you not to make rash choices. If you're especially down in the dumps because of a particularly hard caregiving week or month or whatever, then try to give yourself some space. Space to reflect on what's happened and try to decide whether or not you need to make some changes. Now, all that is easier said than done, of course. But as I have discussed in past videos, most recently the one entitled, Is It Possible to Be a Caretaker All by Yourself?, there are a few options that can help you. I'll defer to some of my other presentations for the details, but once again, you may be able to secure what is called respite care. This is a big one, and it is short-term assistance designed to give the primary caretaker a much-needed break. Know or discover your limits. At a certain point in time, it becomes no good to push too far beyond your reasonable limits. Now, I choose my words very carefully there, and there are 3 operative phrases. A certain point in time, too far beyond, and your reasonable limits. At the end of the day, only you and your family can determine, hopefully in consultation with each other, with friends and with trusted advisors like doctors, financial advisors, lawyers, and so on, what these limits and what these points actually are. But maybe the flip side of making a too hasty decision while you're emotionally low is totally disregarding or refusing to reflect on what your limits are at all. Behaving as if you have no limits can lead you into very dangerous territory. One sign that you might be drifting in that direction might be the following. Number 7, wishing your loved one would die, or wishing that they were already dead. Let's draw a few distinctions. Number 1, there's a distinction between lamenting that your loved one is suffering and focusing on them and on their pain and worrying about their pain because of how it is affecting you. It's upsetting for you. It's tough for you to deal with, for you to witness, and so on. A little personal testimony. My dad wasn't diagnosed with Alzheimer's disease until the summer of 2009. Immediately preceding that diagnosis, he had 2 major surgeries just a few months apart. On the eve of the first surgery, which was a triple bypass, my dad was literally on death's door. Those surgeries prolonged his life for 7 years, as it turned out. But it was super easy for me to ask, for what? What did those surgeries preserve his life for? Why? After all, those years were dominated by his decline, his cognitive decline, his physical decline, everything, financial. I spent 4 of those years caring for my dad in his home, and he spent the last 3 years of his life in a nursing home. And I regularly found myself wishing or wondering, what if he had died in 2009? Or if only he had died in 2009. Now, don't get me wrong. On my better days, what I meant by that was, if only he had died of a heart attack in 2009, he would have been spared 7 years of just deterioration, a downward spiral. In other words, theoretically, with the heart attack, he might have had a quick death, as opposed to just slowly wasting away. Now, there's space here for discussions of various spiritual perspectives, but I'll have to leave that very complicated topic for a future time. Realize you cannot control what life gives you. You can only control how you react or respond to it. Granted, that's easy to say, hard to do. And I confess, not every thought I had was completely altruistic. So number 2, we also want to distinguish between a fleeting bad thought and an all-consuming idea. Though admittedly, there's going to be a vast middle ground between those 2 extremes. Anyone might be susceptible to having an occasional selfish desire. Obviously, you want to guard against obsessing over such thoughts. For me, this challenge mainly came when my dad was in the nursing home. Towards the midpoint of my dad's nursing home stay, my family had its first dealings with hospice. Hospice, of course, is end-of-life palliative care for terminally ill patients. Every time we'd get a call that my dad was being put on hospice, the news hit us like my dad had just received a death sentence. Obviously, I'm speaking loosely. I mean, the Alzheimer's itself was the death sentence. We just didn't realize that a person can seesaw on and off hospice. So roughly half the time my dad was in a nursing home, my family was on edge expecting that he might die any day. This is exhausting, to say the least. Your emotions become like a yo-yo, and it can be financially and physically demanding as well. For example, the first time you think that your loved one is literally at the point of death, you clear your calendar of appointments, you take off work, and you otherwise bend over backwards to make sure that you can be there every moment. If and when they recover, you're relieved and probably not a little surprised, frankly. But then it happens again, and again, and again. Finally, if you're like me, you start to worry about how sustainable that is. Can I keep doing this? Can I keep just taking off work every time they say my dad's on hospice? And you're basically stuck. I mean, if you do react to every wave of hospice on the assumption that that's it, this is the last time, my dad's really going to die this time, then you can place an increasing burden on your family, depending on how many cycles of this you go through. After all, it's not easy to set aside 1 or 2 years for some protracted end-of-life scenario. It's sad, but true. But if you don't respond, if you assume that this is hospice, this has happened a bunch of times, then you run the risk of not being there when your loved one actually passes. And, you don't want them to die alone. So more than once, I found myself wishing that my dad would just die. Because, I'm here this time. Or my mom is with him. Or my sister is in from out of town. And if he pulls through, I don't know who will be available to be with him the next time. Now, the thing to realize here, again, is that we're only human. The best you can do sometimes is just take things one day at a time. One practical step is to just have open and honest communications with your loved one's doctor, with the hospice staff, trying to get a sense of how serious it is. I'll have to do a video just on hospice in terms of trying to explain this a little more for people who don't have the background. Another tip would just be to try to put plans in place for a rainy day, as they say. Regardless of what stage of care they're in, and regardless of where the care is being delivered, obviously, if you have a selfish thought or a destructive thought, you want to nip it in the bud if you can before it flowers into something worse. Again, easier said than done. It may help for you to keep in mind and focus on why you're doing this. Why are you a caretaker? Try to focus on happy memories with your loved one and keep their well-being firmly fixed in your mind. Try to reframe the situation and look at protracted hospice scenarios as if they were giving you golden opportunities to spend a few more precious moments with your loved one than you thought you might get. If you're still in a home care situation, then consider whether thoughts like these might be indicative of an impending breakdown on your part, at least if they are preoccupying you, and try to be honest with yourself. It might be time to seek professional help. That might mean counseling for you, and it might mean professional care services to help lessen and lighten the load. It doesn't do any good to simply deny or bury your feelings. The overall caregiving could easily suffer, and that would be bad for you and bad for your loved one. And all that might lead to something like the next consideration, number 8, regretting your caretaking decisions. It's an understatement to say it, but the caretaking road is tiring. It may also be long and winding. You may feel a bit like you're wandering lost with no clue how long it will take you to get anywhere or to get back. You might have mounting debt and expenses. You yourself may be developing age-related physical problems at the same time that your loved one is deteriorating cognitively. These and many other factors can lead you to seriously ask the question, can I do this? Can I keep doing this? Did I make a mistake by even trying to do this? If you start thinking that it was a mistake for you to start caring for your loved one or taking them into your home or going into your loved one's home, if you start down that road, it's easy for that to lead into a spiral of self-doubt and self-loathing and all kinds of awful things. Realize first and foremost that you're not alone. Probably every caretaker will harbor similar concerns, at least at some level, if they caretake for long enough. Now, this consideration in and of itself probably is not going to allay your fears that you took a wrong turn. I say it, though, to be encouraging, at least as far as this goes, that it's arguably never clear to anyone what the correct path is. You consider your loved one's well-being to be of paramount importance. You gather information. You talk over the options with trusted friends, with family, with advisors. And number 4, you try the best you can to create a livable, workable, sustainable solution for your family. And in short, you play the hand you're dealt the best you can. If ultimately things become unmanageable, then you have to course correct. So if there's no such thing as a correct solution, then there's no such thing as an incorrect one either. You just are doing the best you can on the fly. And maybe that's the best that can be said. Number 9, having to institutionalize your loved one. And all that, of course, leads to this item. And let me come to it by way of a recent comment on one of my videos. The commenter wrote in part, quote, "I cared for my wife on my own. It did not occur to me to farm her out to await death to make my life more comfortable." It's possible, I think, that he misconstrued the "when is it time for a nursing home" as if I were implying that in every care scenario there will come a time inevitably when it will be time for a nursing home. So in other words, everybody's caretaking situation should terminate with a nursing home. And the only question then is, when is that time? But of course, I never said, and I do not believe, that every caretaking situation should or will or does terminate in institutionalization. Either he misconstrued that or he has some objection to nursing homes, period. In other words, that no one should ever use a nursing home, which seems like a very strong position. But his view came across as though electing to put your loved one in a nursing home is tantamount to throwing in the towel at best, or just opting for selfish personal convenience at worst. In other words, it's just seeking the easy way out, shirking your duty, and so on. For our purposes, I'm highlighting this because I think that comments like this can be taken to heart as an indictment of a caretaker's commitment to their loved one, as if the only way to convincingly prove that you love your loved one is to elect to take them in or to care for them personally, and you just stick to that come hell or high water. So since I turned to professional caregiving, I am basically a bad son. Now realize here that no one has walked in your shoes. I personally think that no one should impugn a person's level of care and love for a family member solely on the basis of the fact that they had to turn to a nursing home. If we didn't care, we wouldn't be agonizing over decisions like, should I put them in a nursing home or should I continue to care for them at home? Because the goal is to try to provide them with the best kind of care available. And the question is, where can that care be delivered and by whom? So I think a comment like this is not only uncharitable, but it's also a bit incomprehensible to me. Because again, it implies, or half implies, that nursing homes should never be an option for anybody. But as many of you probably know all too well, it's not always possible or feasible for a family member to be a caretaker even when family members are available. There can be various emotional, financial, physical factors or whatever that prevent a person from stepping into that role. And in fact, I think that if better, more complete care could be delivered in a skilled nursing facility, then you could, in a way, turn the poster's complaint on its head and say that it would be unloving not to put them in a nursing home in that case. Personally, I think things are far more complex and nuanced than either of these two dismissive answers would lead one to believe. I don't think the way forward is always obvious. In fact, I would be hard-pressed to think of a case where the way forward is ever obvious. But if there's any certainty here at all, I think it's that there is no one-size-fits-all approach. Thankfully, though, you have nothing to prove to anyone else. At the end of the day, it is for you, in consultation with family and friends, to make that decision. And you try to make the best decision you can for your loved one, and indeed the best decision you can for your entire family. Number 10, finding that you don't feel anything at all. Up to now, we've been dealing with various experiences that can actively make you feel miserable. And that unhappiness can lead you to wonder if you're an awful person, because if you're doing something loving for your loved one, you're helping them, why would you feel miserable? But what happens if you don't feel anything at all? Someone might hear me talking about how I felt tortured over whether or not I should admit my dad into a nursing home, or how I was actively embarrassed sometimes by my dad when he was out with me in public. And it's perfectly imaginable that someone might hear all that and think, well, I don't have anything like that in my experience. I've never felt those kinds of things. So does that make me an awful person, that I'm not having these kinds of emotional reactions? So realize that people deal with adversity and hardship and challenges very differently. I tend to be an emotional and reactive and even volatile person. So don't compare, and certainly don't judge your own emotional reactions or your lack of emotional reactions to mine or to anyone else's. And also realize that not feeling anything can mean a lot of different things. It might just mean that you're very laid back and you take things in stride. It might also mean that you've become emotionally numb. After all, caretaker burnout is a very real danger. Remember also that emotional flatness can be bound up with the so-called denial stage in grief processing. So, as I stated earlier, just be honest with yourself. You might need to take a break, or you might need to seek professional help, whether that's help for your own mental or physical well-being, or whether that's help with the day-to-day tasks of caretaking. Just be willing to evaluate the situation and try to make an honest appraisal of what that emotional flatness means. Being a caretaker for someone with dementia can make you feel a lot like Sisyphus. You'll recall that in the Greek myth, Sisyphus is fated to push a rock uphill for all eternity. Every time he manages to reach the summit, the rock rolls back down the mountain and he has to do it all over again. Caretaking is frustrating, and it can feel altogether absurd and futile. After all, it's a certainty that the caretaking situation will eventually terminate in their death. Additionally, some of the caretaking measures that you might have to implement can feel like betrayals. And that can be extremely depressing, and it can lead you to feel inadequate or unworthy or even, frankly, wretched. Recently, I realized how many times in past videos I catch myself saying something like, "It sounds bad, but why install double key deadbolts on the entry doors? It sounds bad, but it's so your loved one can't easily get out of your house." How hard is it to care for someone with middle stage dementia? Well, it sounds bad, but it can be more manageable if they're also physically disabled. I was racked with guilt after having my dad admitted into a care facility, and I had nightmares for years afterward. And it sounds bad, but those nightmares were about him coming back into the house. They were about me having to become a caretaker all over again. I was thrown back into that stomach-churning, hopeless situation, and it made me sick to think about. I love my dad. I loved him then. I love him now. You love your afflicted mother, grandmother, grandparent, spouse, child, maybe. And you know they're not actively doing anything to you. They're not oppressing you. They're not attacking you. And you know they are suffering too. In a conversation I once had with my sister in a particularly hard period of time, care-wise, I remember her saying, "I know, talking to me, that you're dealing with a lot of stuff and this is hard," but she's like, Dad is in an awful place too. And that's an understatement, obviously. Trying to imagine what it was like for him is just sickening, frankly. You're stuck inside a body or stuck with a brain that either cannot or does not or will not cooperate with you. I picture being stuck in a windowless room, cut off from everybody else, and then eventually you're cut off from yourself. It's just horrifying. It's hellish even. And deep down, we know all of this full well. The amount of pain, the enormity of the situation is just frankly terrifying. And despite the fact that it's like they don't recognize you, it's like they treat you like a stranger, you still want to believe that deep down they still know who you are. And that in their heart of hearts, they still care for you, they still remember you, and they appreciate what you're doing for them. You want to know that that bond of love that you had with them is still intact. And in a sense, it's that belief, it's in a sense that hope that adds insult to injury. Because you desperately want to help them. You desperately want to help the person that you know and love. And they're not acting like the person that you knew when they're cursing you out or throwing things at you, when they profess to not know who you are and they act as though they really don't. They treat you like an intruder or someone who's trying to hurt them and hamper them. When they refuse to do basic things for themselves like bathe and toilet, or when you're having to clean feces up off of your carpet, you can feel totally, thoroughly demoralized. And the situation creates an almost impossible and almost unlivable tension. You're sick over the prospect of confining them to a nursing home. But at the same time, you know or you believe or you fear that you just cannot go on living like this in the house. Or you're literally going to have a breakdown or go insane. The psychic pressure can just build to a point where it can lead you to really, really dark places. And I've been there, and that is what we've been exploring in this video. But I would prefer, if I can, to not leave things on such a negative note. So please know that I truly, truly, truly empathize. And if you are presently going through a hard time, I invite you to share your experiences, your feelings, your fears in the comments. And if you went through a similarly harrowing journey in the past, then I also invite you to share that. Because I've seen some really beautiful exchanges in the comments where people are helping each other. And I sincerely believe that people who are presently experiencing this kind of self-doubt or even self-loathing can really benefit by reading the perspectives of people who had these kinds of experiences in the past and survived them, who got through them. And I hope that, if nothing else, the video encourages you that you're not alone. Nothing here can be construed as professional therapeutic advice or counseling advice in a strict sense. But I hope that just the camaraderie or just the shared experience set to know that you're not alone is sometimes the only thing you can hope for, and the only thing that might get you through the next minute, the next day. And I do wish you all the best, and I thank you for watching.